Hello again. If you're waiting for joint replacement surgery and you've been told to lose weight, you're not alone. It's so difficult when you're in constant pain, sleeping badly and feeling pretty grim most of the time. A bit of comfort eating is understandable, but it doesn't help in the battle of the bulge. I've seen several people recently who are having appetite suppressant injections, things like Ozempic and more commonly Mounjaro. These are the so-called skinny jabs. But are they safe? Do they actually help before surgery? And should you consider taking them? Keep watching and I'll explain. We all know that excess weight puts more strain on your hips and knees. It also raises the risks of surgical complications like infections and blood clots. It delays recovery and can lead to your new joint wearing out more quickly. Losing weight before surgery, even 5 to 10% of your body weight, can really improve your outcome. Ozempic and Mounjaro are drugs that were originally developed to treat type 2 diabetes. They act not only on the pancreas, which produces the hormones insulin and glucagon, but also on the stomach and the brain. The effect of the drugs is that they make you not want to eat as much because they signal to the gut and your brain that you're full. You aren't as hungry and you eat less. The drugs are injected once a week and they really help people lose significant amounts of weight within months. Recently, there have been some new guidelines on the use of the drugs. GPs will be able to prescribe them to people who are severely overweight and who have associated medical problems like high blood pressure and diabetes. If you're trying to lose weight before your operation, these medications can be really effective, particularly if traditional diet and exercise plans haven't worked for you. But you won't be able to get an NHS prescription unless you meet the criteria. Some people are prepared to pay for a private prescription from a pharmacy or private weight loss service. But it's not just about your weight. Reducing visceral fat, the fat around your organs like the stomach and liver, improves your metabolic health, reduces inflammation and helps your body heal better after surgery. So, are these drugs safe to use before joint replacement surgery? The short answer is yes, as long as they're prescribed properly and they are used as part of an overall weight reduction program. There are lots of online pharmacies that will sell you the injections, but you must speak to your GP before starting them. They can interact with other medications, and there are concerns that they can cause inflammation of the pancreas in some people. This is a serious and sometimes life-threatening medical problem, and you really wouldn't want to have it. Anything else to know about? Well, if you're a woman on the oral contraceptive, they can make it less effective, so you should use alternative means of contraception. Another thing that's a concern is the risk of aspirating the contents of your stomach during surgery. This is why we tell you to be nil by mouth before your operation. If you aspirate, fluid from your stomach gets into the lungs and causes severe pneumonia. We had to postpone surgery recently for someone who was at a high risk of aspiration. We stopped her injections for a month. The current guidelines say that there's no need to stop them routinely before surgery, but each case must be taken on its merits. We'll advise you what to do. These drugs are powerful tools, but they're not magic bullets. They work best when they're combined with nutritional guidance and exercises tailored to your condition and ability. You need to have realistic long-term goals and plan for them. If you're waiting for surgery and don't know where to start, talk to your GP or your surgeon. Think about how much and what you eat and start to make changes that will help you get in better shape before your surgery. Basically, stop eating carbs and eat more protein. Losing weight safely before surgery can really help to make it safer and improve your chances of a successful outcome. Have any of you used these new drugs? Please share your experience in the comments below. And of course, if you've got any questions, please get in touch. Thanks for watching, and I'll see you all again next time.